Good evening. Welcome to my blog, where we talk about how to make ourselves happier, healthier, and more productive while on quarantine. For tonight's episode, I want to look back on an earlier discussion on mental health. It's just one of the most popular episodes so far in my series, and I think it is something that people have a lot of questions about when they are stuck at home. When outside of them, the world seems relatively chaotic compared to anything that most of us have lived through. And so we're all nervous and we're worried, and mental health is a really big question, especially when you're stuck at home all day and you might not have your regular outlets to deal with it. Luckily here in Vienna, we do have the possibility of getting outside. I just finished an hour-and-a-half bike ride, and that is probably for me the most important thing for my own mental health, is just getting outside and getting some fresh air and exercise. And I would still encourage people to consider, even if it's something they don't take part in regularly, to maybe get outside a bit more and just be able to get out of your house. The possibility of picking up coronavirus if you're in the middle of the woods or a large park is quite minimal, so please do get out there. And then the other main topic related to mental health I want to discuss tonight is just what is happening out there and the fact it is all going to be okay. And I don't mean that the virus is suddenly going to disappear, but other things around the virus are likely already starting to look a bit better. So for instance, countries have managed to react to changes in the economy and try to put in some money so that the coronavirus doesn't impact our economies too greatly. Obviously, we are in the start of a recession, but like every single recession that's happened before, we will get out of it. In terms of food security, I can understand that in North America especially, people might be quite concerned about the food on the shelves in the grocery store. Unfortunately, grocery stores are just not made for the type of panic buying that we've seen so far, but it doesn't mean that we're running out of food in the medium term. It's just a short-term issue. What happens is that if just a few people buy 20% more groceries than they normally do, quite quickly the grocery stores will run out, because with the just-on-time warehousing and stocking of their shelves, what happens is most grocery stores have a constant flow of goods coming through, so that they have minimum in the back stores and that things are out on the shelves, and then they get refilled through the cycle. But they're just not able to deal with a giant change in consumer behavior like what we've seen. But the UN, Food and Agriculture Organization, even specifically did come out with a statement saying that it is not a supply issue, but a behavioral change over food security. And so not something that we have to worry about as soon as the grocery stores and the production lines have enough time just to refill the shelves that have been emptied. They have lots of food still coming in. Similarly, medical equipment and tests are already becoming more available as factories are changing their production lines over to masks and respirators and this kind of thing. And it's the same kind of supply and demand question, where suddenly you have an increase in demand and it just takes a bit of time before they increase supply. It's simple capitalism. It's supply and demand equations, but there's a time lag between those two on both sides. But what that does mean is that countries are now bringing up the levels of testing, and as this occurs, and as we learn more about the virus, fatality rates will also start falling. In Austria and our neighbors Germany, the fatality rates are actually really low compared to most other Western nations with high rates of coronavirus. And this is largely due to the number of tests that are undertaken here. So what that means is that, one, you catch it a little bit earlier, but more importantly, the rate is just not as it seems in other places where they're not testing enough people. And so in Italy, for instance, it looks like 10% of people who get coronavirus die, but it is just because there's actually way more people in Italy with the virus who've never been tested, never been proven to have it. So they don't show up in the number of cases, And the people who die, it's easy to demonstrate that they've had the virus, and so they do show up in the fatalities related to coronavirus. But in reality, the survival rate is higher than 90% in Italy and anywhere else. So Austria, for instance, tests currently 15,000 people per day for coronavirus, while the UK only tests 10,000 people per day, even though they have 8 times the population of Austria. And what we're going to see is that these other countries are going to catch up with Austrian and German examples for testing, or South Korea, where they've managed to test, to trace, and to treat more effectively than others. And what we have is that the combination of education and testing equals a higher obeyance of stay-at-home regulations and a better knowledge of how the disease is spreading, and then a better ability for medical workers to respond and the government to respond to lock down and make other changes and treatment changes specifically to those populations who need it more. This is also what we'll see more of in the future, is that China, for instance, is easing the restrictions in Wuhan and in areas affected by coronavirus, but they won't do it wholesale. And as pockets of the coronavirus flare up, they'll have more targeted approaches to dealing with those flare-ups. And so these countrywide restrictions and quarantines that we currently have in place will slowly be targeted towards the areas that are most needed. But at the time being, when we don't have enough of that information, this is the only way to get through it and be able to ensure that nobody's passing on the virus to others in such a capacity that the medical system is unable to cope. So in the weeks ahead, what we will see is those countries that have been laggards being able to catch up, both in terms of equipment and policy, isolation, testing, this kind of thing, and eventual relaxation of the restrictions that we've seen. It will just take a few weeks, so bear with us, folks. Hopefully this will have helped your mental health by being reassured that things will get better, that the economy will get better, the treatments will get better. Eventually we'll have a solution, a vaccine for the virus, and don't try not to spend too much time worrying about the world out there, not because it's not a scary place, but just because worrying about it won't make a difference anyways. Thanks for joining me today, and hopefully this vlog is helping you make your life happier, healthier, and more productive while in quarantine. Thank you.